Well, hello everybody. I wanted to share some news. Yesterday we met with my medical oncologist for the first time since the surgery and learned about PNI, or perineural invasion. Although my tumor was very well excised, with some nice cancer-free margins around it, they did notice some PNI, and this PNI is where a part of my tumor was right up against the myelin sheath around a nerve. And cancer often uses nerves as a route for metastasis to other parts of the body, so this is a risk for future occurrence for me. PNI is pretty common in head and neck cancers too, apparently, and normally it would be treated with radiation when it's discovered. But unfortunately for me, since they already irradiated the heck out of my neck in 2005, they can't do that again. So, because my neck tissues just couldn't handle it, my neck tissues are already having a hard time healing this thing, which is making a lot of noise. Sorry, I'm going to keep my finger on it. I keep forgetting to do that. So this stoma hasn't healed yet. So they may need to stitch it back up instead of letting it heal on its own. But that's probably because the radiation made these cells less able to heal. So the other two big non-surgical tools that they could use to treat additional cancer, if they find any, are chemotherapy and immunotherapy, but neither of those has been shown to be effective against PNI. So for now, the treatment will be just to monitor me closely and wait to see if anything comes of it. And the PNI thing may or may not cause trouble down the road. We just don't know. So on the upside, though, and let's emphasize this part of it, the much more scary LVI, or lymphovascular invasion, there's absolutely no evidence whatsoever of that. And, that's what I had in 2005. It had metastasized to several of my lymph nodes. That's why it was a much greater risk of death then. So they'll be monitoring me very closely for the next 15 years even. And that monitoring will start really with another PET scan in about 3 months to see if anything significant shows up. The reason they have to wait 3 months is because all of the healing that's going on in my tongue right now would light up like a Christmas tree and obscure any evidence of cancer that was in there. So they need to wait for a little while to let that heal up. And there's one more thing I wanted to tell you about, but this one is only a relatively short-term annoyance, but it could be for 6 months or a little bit more than that. Starting on Tuesday, it started to get harder for me to speak, and you maybe can tell this already. The doctors say that when the underlying tissue in my tongue started to heal, they can sometimes pull themselves together, kind of pushing up the part they call the flap. And it seems like that's what's happening to my tongue right now. That's what they think is happening. The flap is healing well, and it's already pretty well integrated into my tongue. And it looks, nice and pink and feels good, except for the lump. And I think that it's less swollen overall. Unfortunately, though, it's being pushed upward, which makes many language sounds very difficult to enunciate. Actually, I think you probably can see it. See that unusual bump on the back of my tongue? It's pretty annoying. On the upside, the lump has been pulled away from the back and towards the top of my tongue, which means that swallowing has become easier. And although I'm still supposed to be mostly eating soft foods, I have been eating some regular foods, and there's no problem there at all. And I have an appointment on Monday with the speech and swallow therapist, and I'm hoping she will say I'm green lighted to eat more regular food. But I've eaten quite a lot of regular food in the last week or 10 days. So the lump, this annoying lump, it may be a temporary phenomenon and may flatten out over the next 6 weeks or so, or it might not. And if it remains, they'll go back in and do what they call debulk some of that new tissue to flatten things out. So they'll cut open my tongue again, and they'll take out some tissue and sew it back up again. But of all the possible problems that I could have had after this, the surgery, this is one of the better ones because it's quite easy to remove tissue, and much easier than adding new tissue. And any tissue removal will have to wait though. So they need a solid 6 months to be really sure that the flap is fully integrated, especially because of the compromised tissues in my head and neck because of previous cancer treatment. So the surgery then would be pretty similar to what I just went through, except simpler. No flap has to come off of my arm. You can see my arm and my scars. I don't know if I've shown these before, but I have scars in a few places on my arm where they took a blood vessel and a chunk of flesh. There won't be any of that, of course, and they just have to go in, cut out some tissue, and stitch it back up again. But I'll likely have to have a tracheotomy again because, it will be difficult to swallow while the tongue is healing. And they also want to keep stuff out of the mouth area while it's healing. But, and that, a tube to feed during that time period. But that's no big deal. Been there, done that. I can do it again. It was like seven days or something like that. I had to live with that last time. It seemed like an eternity at the time, but it wasn't that long. Again, the surgery might not be necessary. We'll see. In any case, the long-term prognosis for my tongue is very good. It'll either shrink on its own or they'll shrink it for me. I did want to mention that these donor sites on my arm are healing really nicely. The two long scars are almost completely healed up. And most of the flap area that's underneath the tulpa, thing here is really well healed too. Not perfect yet, but the doctors are pleased with it. It's not quite ready for me to get back on my mountain bike, unfortunately, but soon. I guess I really miss riding with my biking buddies. So overall, I should say I do feel really great now. I'm much stronger than I was a week ago. I'm eating well, and I'm on the elliptical for 20 minutes every day. I'm doing some light weightlifting to trying to get back to basic normality, and I guess I just want to say I'm really appreciative of everybody being so supportive. I'm very grateful for all of you. Bye.